Hello, welcome to another edition of Doctor's Orders by Dr Farooq. Today I'm going to address why is it that certain groups of people are at much higher risk of serious illness from COVID-19. And also I'd like to give some brief advice to those people who wish to fast during the month of Ramadan during the coronavirus crisis. So the first risk factor that was identified from Wuhan was being of an older age. We see this happening with flu as well. And it's fair to say that the immune function does decline as you get older, but there can be a wide variation. For instance, I had a 92-year-old lady who developed coronavirus and she was absolutely fine afterwards. The young are not invulnerable to this either. We have had cases of a 13-year-old who died in King's College Hospital. This leads us to a term called the infection enigma. This can happen with many other diseases such as malaria or TB because we all react differently and we have different pathways in our response. One of these responses is called the cytokine storm, where your immune system overreacts, often in the second week. Antibodies, which are proteins that kill invaders and create our memory, they backfire. Instead of blocking the virus, they overreact and produce lots of dangerous chemicals. Hence, they lead to further inflammation, and perhaps the inflammation could be the important factor. Down to the weaker sex. Well, in this case, it is men who are the weaker sex. Women do seem to have a stronger immune system, and this leads to their term called man flu. It seems that women also get more autoimmune conditions as a result, though. Males might have more risk factors, such as smoking, drinking and their occupations, and also more obesity. So that could explain why males have a higher level. But exposure levels are important, and this could explain why healthcare workers seem to have more of this illness, even if they are otherwise fit and healthy. Because they are exposed to more of this disease, there will be higher numbers of the viruses that will replicate inside their system. And I'm sure it doesn't help if somebody coughs in your face. The other factor could be the air pollution. That might be causing more damage to your lungs, and that might be why there's more in urban areas, although more overcrowding could also explain this. So this does lead to a debate about PPE, making sure there's enough personal protective equipment for healthcare workers, but also should the public be wearing them or not? Well, it really depends, and if you look at the photo here, it does show that even if you wear something simple, such as a cloth mask, you are reducing your exposure to other people. So therefore, it might be something worth considering, but use it correctly and do not cause the reduction in supply levels for the healthcare workers as a result. So could something be explained by genetics? Scientists have been looking for genetic clues as to why Asians and the black population, especially healthcare workers, are 30% more affected than expected from the population. But for many years, scientists have been looking for genetic explanations for ethnic differences in chronic diseases. They've not really been able to find one. And it can be an easy cop-out to say it's all down to genes and there's nothing I can do about it. So, are there other reasons why the BME population is worst affected rather than just poor genes? The first explanation could be demographics. We know that the first and worst hit areas were London and Birmingham. We also know that the areas in London worst hit were Barnet and Hendon, all areas with high BME populations. Also, comorbidities. We know that more than 3/4 of those admitted to ITU had diabetes, heart disease or high blood pressure. And we know that diabetes and blood pressure affects the BME population also at a younger age. High-risk occupations are also a factor. We know that the BME population tends to work in healthcare, transport and retail. And finally, social situations. They tend to live in deprived, overcrowded urban areas. They tend to be more poor and disadvantaged and live in multi-generation households, which means it's much more difficult to socially isolate. So as we have Ramadan around the corner, people are asking me about what are the positive and negative effects of fasting on your health, especially with coronavirus. And the fact is, we have no studies specifically about coronavirus. We can only go with what we have got from before. We do know, for instance, in the last year or two, there's been a lot of positive studies about the positive effects of fasting on your body. And in some cases, we've seen where diabetes can actually be reversed by fasting, hence proving that potentially fasting can be good for your health. So what are the effects on the immunity if you spend all day denying yourself food and drink? Well, previous studies in Ramadan showed that fasting only mildly affects your immune system, and after Ramadan is over, it goes back to normal. And there are some beneficial effects on your cholesterol and also on oxidative stress. In other words, the inflammation in your system. It is safe in asthmatics, in autoimmune conditions, as well as those who suffer with HIV. So if you are fit and healthy, yes, you should be able to fast without any problems, even during the coronavirus crisis. But a word of warning, if you develop any symptoms such as fever, cough, loss of taste and smell, or shortness of breath along with fatigue, this in itself could lead to reduced fluid intake and significant dehydration. Plus, it can cause a rapid deterioration even within hours, especially in the second week. So if you have any symptoms at all of coronavirus, then remember you have got a dispensation. Remember that if any of you who are sick or on a journey can make up your fast later. It is important to remember, even during this time, that we are still in lockdown. We've still got certain rules we need to follow. You need to abide by those rules. You need to remember about social distancing. That means not gathering in large places, not praying in congregation. It also means that you should follow the rules, that if you are unwell, you need to be isolated at home. And if somebody in your family is unwell, you also need to spend up to 2 weeks also at home and isolating. And remember, if you need to isolate, you can still do that potentially, but remember the rules that are clear on the government website. There are lots of videos out there explaining this in more detail. You can look at the BEMA website. They've produced some very good videos about this. I do want to bear something in mind, which is hydration. This has been the main difference with those ending up in ITU. Essentially, your blood is becoming sticky and this can clot. So it's very important, if you are fasting, you must get enough fluid into your body, 2 to 3 liters, when you are allowed to drink. We do know that fasting does not have any negative effects on your water under normal circumstances, but again, we have got no studies regarding COVID-19 and exactly what effects it has on your body. So what if you do have some medical conditions? Is it safe for you to fast during this time period? Well, ultimately, it's very important that you have to get your risk stratified according to your medical condition, your stability, your previous fasting experience, your current situation. I'm going to do another video specifically about medical conditions and fasting, including diabetes, so please do look out for that very soon. So thanks for listening to me today. I have been Dr. Asim Farooq, and you have been watching Doctor's Orders, the YouTube channel. Please subscribe to my channel, share this video widely, and if you have any questions, put them in the comments below. If you have any more queries, then again, you can personally contact me. In the meantime, remember to follow Doctor's Orders.